So I'm going to talk today about stretching the adductor muscles. I'm going to give you the stretches right now, but right after that I'm going to be showing you some illustrations of what the adductor muscles look like. So adduction means, or is spelled A-D-D-U-C-T-I-O-N, adduction. That means to bring things close to the middle. So the adductors are muscles that bring our legs together. And you'll see in a minute when you see the picture of the young woman in the gym, you'll now know that's an adductor machine. It brings the legs together. So adductor muscles are on the insides of your legs. And there's four basic muscles in that group. There's the adductor magnus, the adductor longus, the adductor brevis, and the pectineus. Four major muscle groups that come on the inside. If you're watching this tape because I've asked you to, or this video, it's because you have adductor tendinosis, which means that many of the muscles that contribute into the adductor compartment are short and irritated. And you may not even know that they hurt there. A lot of the people that I see that have adductor tendinosis have a primary pain of hip and lower back pain because all the adductors are attached to the bone structure deep inside your pelvis. So we want to address those muscles by doing two things. We're going to stretch them, which I'm going to show you right now, and after we're done with that, I'm going to show you how to compress those muscles in order to help them to rehabilitate. We're going to be using a 2-pound medicine ball to do that. So here's the first thing, which is the stretch of the adductor muscle. Not very difficult, but you have to do it right, so follow along. So you're going to be in this neutral position. You're going to take one leg and put it outside with the toes oriented forward. You have to tilt your tush up in the air. It has to go up. Accentuate your butt to come up. And then keep your head down so that your spine is straight and move back just 3 or 4 inches until you feel all the pull of the adductor muscles. You don't have to go that far if you have your butt tilted up. If you don't tilt your butt up, you might wind up way down here. So try to keep the tush in the air and that foot on the floor going forward. And as you lift your butt up, just slide backwards and you'll immediately feel a long stretch all the way through the adductor compartment. I want you to do 10 repetitions on each leg side to side to get a good deep stretch of those muscles. So now I'm going to go into showing you some of the illustrations of the adductors so it makes more sense in your mind's eye. And then I'll show you how to break up the adhesions in there with a medicine ball. So check this out. So this should be something that you recognize quite often, especially if you're somebody who works out in the gym. A lot of people, especially our women athletes, tend to use this equipment quite often to build those muscles on the inner thighs. You can see in the illustration that there are, a group of muscles there on the inside of the thigh, all adductors, as you can see in the name of the muscle, A-D-D-U-C-T-O-R. Adduction means to bring close to the middle. So this athlete will bring her legs in, bring her knees together, and that's the function of adduction. So those muscles get the name adductor. There's the adductor longus, the adductor brevis, the adductor magnus. Did I say magnus? Longus, I guess. So there's 3 of them, and there's another one up there called the pectineus that make up the adductor group. But as you can see, these are the areas of the adductors, and the therapy that we're going to provide through stretching and compression is directly to these tissues on the insides of the thigh. This is just another really good image of the adductor group. The muscle down closer to the knee is the adductor magnus. As you move up, you have the adductor longus. When you get up a little further, you get the adductor brevis. And the last muscle that's just on a little triangle there, that's the pectineus muscle. You'll notice that these muscles all attached to your pelvis. That's called the ilium, that entire bone that looks like ears of a bat, if you will. But where they attach is a special area of the ilium called the ischium. And the attachment of those muscles to the bone are through the adductor tendon. And it's probable that if you're watching this that you've developed some adductor tendinosis, where the tendons are irritated as they begin to invest themselves into the bone structure deep in the groin. The problem with this from a chiropractic perspective is when you develop adductor tendinosis, you put a lot of stress and strain on the pelvis, which then puts stress on the lower back, promoting lower back pain, disc degeneration, and in some worsening cases, disc herniation. So it's important that these tissues that you see in red are flexible and decompressed on a consistent basis. This is just another example of the same muscles on the right inner thigh, the right adductor group. You'll see how all of the muscle in red invests itself into your pelvis. Therefore, adductor tendinosis promotes significant stress on the pelvic structures, leading to lower back pain and poor performance. And last but not least, we see where the muscles lie from the outside of the body. This is important because when you use the medicine ball to break up the adhesions, it's good to have a visual image of where these muscles are. Again, the muscle more distal from your pelvis, or the one closest to your knee, is the adductor magnus. As you move up, you'll see the adductor longus and the adductor brevis. You don't see the pectineus here because it's a little deeper under the shorts of the model, and it just wasn't shown today. The gracilis is definitely a muscle of the inner thigh, but in this illustration, it's there mostly to give you a border and a basic indication of where these other adductor muscles relate to. So there's one other one, the blue one, the sartorius, that runs across your leg from the opposite ilium on the right side of your pelvis. So I'm not concerned about that one either. Mostly concerned about the adductor longus, adductor magnus brevis, and the pectineus muscle. So let's talk now a little bit about how to decompress these by using the medicine ball. All right, so this is what we're going to do to work on the adductor muscles. First thing you're going to need is a ball similar to this. This one is a 2-pound medicine ball. Medicine balls come in many different poundages, 2, 4, 6, 8, all the way up to 30-something. They get bigger. So what this ball does, it's very dense and it doesn't bounce very well because it's made to give resistance. So this one was purchased at Perform Better online. That's the name of it, performbetter.com. 2-pound med ball like this will cost you 25 bucks. Is that appropriate to spend 25 bucks to work on these tissues? You bet. You got to break this stuff up and get yourself back in shape. Plus, there's 1,000 other applications that you could use this for in getting yourself back into good physical conditioning. This is a good ball to have. All right. Now you'll notice that I'm at my desk here at the office. You're going to want to be doing this in an upright posture with your leg up on something. You can't do it well on the floor because you can't get your legs in the position that you need to. So you've already seen the illustrations. You've seen the muscles along the inside of the leg. So what we're going to do is, we're not going to roll, so to speak, rolling it out like we're rolling a big dough ball. We're just going to compress tissue. So I'm going to take my leg up here, and I'm going to start down low, right in the area of the adductor magnus. And I'm going to lay my leg over it, not like this, but up like this. And I'm going to work back and forth, and then find that point that's really hurting, because I have my own issues. And it hurts like a son of a gun, so you hold it there. Then you move up just a teeny bit, and you get into the adductor longus, and you hold it there, which is also painful. Then you move up into the adductor brevis, which is further up the thigh, with the leg out like this, and then you try to relax your leg and let the compression work over the tissue, and it should hurt. That's the whole idea. Ultimately, you want to bring it all the way up to where all 4 tendons come together up inside the pelvic bone, and put pressure on that and just let your weight rock onto that. You got to find those points too. I mean, where one person's pain is might not be as much in the next. Certainly I feel it there. So I'm coming forward over the front right there. Holy moly. You will be just shocked when you get in here and feel how much pain that you can incite. Now listen, I'm not here to just make pain. But the reality is if you're in a great physical shape and these tissues have not become a problem over time, then this will never hurt. If it doesn't hurt, and I've told you to watch this, it's because you're not doing it well enough. You've got to get in there. When you feel the pain, you go, oh, hold it there. 5-10 seconds on each point. Work it up one side of the leg, start with the other side, do the same thing. Come up, work down closer to the knee, then come up towards the middle of your thigh, all the way up to the inside of the thigh, and then get right up inside the bone structure. This is my more difficult side on my left. Get all the way up deep into the pelvis. And you should be doing these every day or every other day, depending on how much pain or how much dysfunction is in there. But maybe 10 minutes of this. I'm not going to say a bunch of repetitions. Just get 5 or 10 minutes
try to split up the time with both legs. Use this to break up the adhesions in those adductor muscles. This will help to restore the tissue and the range of motion of your pelvis and diminish your pain, while also doing something very important, and that is increasing your performance. I hope this helps.